Hi everybody, welcome to part 2 of Arterial Blood Gases for Dr. Manny's YouTube Learn Shops. What we're going to do in this session we're going to look at normal arterial blood gas baseline data that you want for analysis, and then we're going to interpret the data for the arterial blood gas analysis. So when we look at the baseline data, let's look at the overview. The rationale for arterial blood gas sampling, as we said previously, is to look at the pH analysis, which reflects the hydrogen ion and the bicarbonate concentration in arterial blood. Remembering that small pH changes may cause irreversible cellular and intracellular damage. So, what's the arterial blood pH? Well, the normal arterial blood gas range for pH is 7.35 to 7.45 with a mean of 7.40, meaning that typically we would all have a pH of 7.40 if everything was okay. And look at the range. The range is very, very narrow. 7.35 to 7.45. If it deviates above or below that, it's potentially harmful to us. The rationale for PaCO₂, as we mentioned previously, this is the amount of carbon dioxide in arterial blood, which indicates gas exchange and, most importantly, ventilation effectiveness. But remember, this is taken at a standard pressure at sea level, which is equal to 1 atmosphere, which is 760 millimeters of mercury, or typically here 101.325 kilopascals. If you're above sea level or below sea level, this will alter PaCO₂ level in your arterial blood. So what's arterial PaCO₂? Well, it's the amount, as we said, of carbon dioxide in arterial blood, and the normal range is typically 35 millimeters of mercury to 45 millimeters of mercury with a mean of 40. And if we're looking at kilopascals, we're looking at 5.1 to 5.6 kilopascals. But remember again, this is at a standard pressure at sea level, which means 1 atmosphere equals 760 millimeters of mercury, or 101.3 kilopascals. Then we have PaO₂ analysis. And the rationale, as we mentioned previously in part 1, is the amount of oxygen in arterial blood, which indicates gas exchange and ventilation effectiveness again. But again, I know I'm repeating myself. This is at a standard pressure at sea level, which is equal to 1 atmosphere, 760 millimeters of mercury, or 101.3 kilopascals. If you're above sea level, it's going to alter your arterial blood gas sample. It's going to be different. You're going to have a different range. So what is the arterial PaO₂? Well, the normal range is 80 to 100 millimeters of mercury with a mean of 90 millimeters of mercury. Or, if you're looking at kilopascals, 10.5 to 13.5 at sea level. 1 atmosphere, 760 millimeters of mercury, 101.3 kilopascals. Then we've got bicarbonate analysis, which we mentioned previously was the amount of bicarbonate in arterial blood, which indicates the amount of base alkaline bicarbonate available in the event that there is potentially harmful excess acid. It's the alkaline reserve. What then is arterial bicarbonate? Well, it's the amount of bicarbonate that is in arterial blood. It's the alkaline reserve. And even though the ranges tend to vary, I've accepted the most generic range, which is typically 22 to 28 millimoles per litre with a mean of 26. That's your arterial bicarbonate available in the event that you've got unwanted acid which needs to be neutralized. And as we said previously, the base excess or deficit, this reflects all the bicarbonate in arterial blood. Because bicarbonate can be in the plasma, it can be in different systems, it can just be in your blood, as we mentioned previously, the bicarbonate reserve. It reflects all the bicarbonate in the body. And it doesn't typically give you a figure, which I could give you, but I'm not going to give you the figure. It's just typically stated as you have a base excess or a base deficit. And the normal range is from +3 to -3. +3 indicates an excess, -3 indicates a deficit. But typically the mean would be 0. It's in balance. Then we have the SaO2, which when we do some case studies later on, we won't review into. But the SaO2, as we mentioned previously, is the amount of oxygen bound to hemoglobin in arterial blood, and it's dependent on the PaO2. And typically, it's about 95 to 100% on room air at sea level, 1 atmospheric pressure, 760 millimeters of mercury. So oxygen typically in air is about 20.8 to about 21%. That's the normal range. So when we interpret an arterial blood gas sample, what are we doing? First of all, step 1 is look at your pH. And I always look at the pH because the pH basically tells you a story. And the story is there an acid-base problem? Is it in normal range, 7.35 to 7.45? Or is there an acidemia, an acidosis, too much acid, which will decrease the pH to less than 7.35? Or is there an alkalemia, too much base, an alkalosis, alkaline agent? And this will be reflected in the pH being more than 7.45. It's a very narrow range, 7.35 to 7.45. Less than 7.35 indicates an acidosis, acidemia. More than 7.45 indicates an alkalosis, alkalemia. None of which your body likes. An acidosis, less than 7.35, reflects that there's too much acid or hydrochloric acid in the blood. An alkalosis, greater than 7.45, reflects that there's too much base or bicarbonate in the blood. It tells the story. The pH says, is there an acidemia, an alkalemia, or is everything okay? Step 2, you've got to decide what the problem is. You've got to determine whether it's a respiratory problem or a metabolic problem. As we mentioned previously, respiratory reflects something with the pulmonary system. Metabolic can be anything. But typically, the organ that helps when there's a metabolic problem will be the kidneys. So you've got to determine whether it's a respiratory problem, a metabolic problem, or both. Respiratory means the lungs are involved. Metabolic means it involves all other organ systems, or could involve all other organ systems in the body. Now I want you to remember that respiratory problems will affect and change the PaCO2. If you're hypoventilating, this decreases excretion of CO2, and the PaCO2 will increase to more than 45 millimeters of mercury, causing a respiratory acidosis. A respiratory acidosis which causes an acidemia. If you're hyperventilating, this increases CO2 excretion, and the PaCO2 will decrease to less than 35 millimeters of mercury, causing a respiratory alkalosis. You're hyperventilating. So what are some of the causes that are related to respiratory problems which will affect and change the PaCO₂? Well, causes of a respiratory acidosis are numerous. I've just put some here. It's related to hyperventilation, which could be due to medications or toxins which affect your respiration. It could be related to central nervous system diseases. There could be an airflow obstruction due to something like asthma or chronic obstructive pulmonary diseases like emphysema. It could be related to sleep apnea and airway edema, which could be related to allergies. Then you've got a respiratory alkalosis which causes hyperventilation. And this occurs most commonly in response to hypoxia or a metabolic acidosis, compensatory, which we'll be discussing later, or increased metabolic demands such as high temperatures, which could include fevers, or maybe you're in pain, or maybe you're really, really stressed and anxious. Remember, when we talk about metabolic problems will affect and change the bicarbonate and the base deficit. They work together. So a low bicarbonate of less than 22 millimoles per litre means that you have a base deficit of less than -3. And this will indicate a metabolic acidosis, either due to the loss or use of bicarbonate. Your body's using it to fight an increase in acid somewhere in your body. A high bicarbonate of greater than 28 millimoles per litre is a base excess. And this means that you've got more than +3. And this means that you've got a metabolic alkalosis and you're gaining bicarbonate in your body, or maybe you're losing acid somewhere. So proportion of base and acid becomes disproportionate. But typically, think of it as a metabolic alkalosis is where you're gaining bicarbonate. But don't forget, you might be losing acid. When we look at causes of metabolic problems that affect change in the bicarbonate base deficit, you've got a metabolic acidosis. And this means you've got low bicarbonate and a low base deficit. Less than 22, -3, more so. And this is due to gastrointestinal losses where you can lose bicarbonate, especially in children, where they have severe diarrhea and they can lose a lot of bicarbonate. Or it could be related to renal tubular acidosis, hyperkalemia, renal failure, increased lactic acid production, as you see in heart failure and diabetic ketoacidosis. Or it can be related to metabolic alkalosis, where you have a high bicarbonate and a higher base excess, greater than 22, greater than +3. And this is due to gastric acid loss with recurrent vomiting, which sometimes you see with gastroenteritis, or maybe hyperemesis gravidarum in pregnancy. You can have excessive nasogastric suction, which you can see in most long-term care centres or acute care centres, and use of diuretics. So let's review. What's your ABG analysis now? Now look, here's your blood gas. I haven't included the SaO2s, but typically if you're hypoxic, you'll have a low SaO2. pH 7.40, PaCO₂ 40, PaO₂ 90, bicarb 25, base 0. They're breathing room air. What's your analysis? These are normal arterial blood gases. Okay, have a look at this one. What do you think? pH 7.3, PaCO₂ 60, PaO₂ 60, bicarbonate 25, base 0. They're breathing room air. No enriched oxygen. They've got hypoxia. The PaO₂ is less than 80. millimeters of mercury on room air. They've got a respiratory acidosis, which means they're hypoventilating. Their PaCO₂ is 60, which is greater than 45, and their pH is acid, which is less than 7.35. Remember, the pH tells the story. pH says acidemia, acidosis. You've got to find the problem. PaCO₂ is high, they're hypoventilating, it's greater than 45. Their bicarbonate is normal, their base is normal, and they're hypoxic. Their PaO₂ is less than 80 millimeters of mercury, it's 60. They have hypoxia and a respiratory acidosis, for whatever the reason. Then you've got another one. What do you think? pH 7.3, PaCO₂ 40, PaO₂ 90, bicarb 18, base -6. They're breathing room air. So they're breathing room air, they're not hypoxic. Their pH is saying acidemia, less than 7.35. Their PaCO₂ is now 40, which is normal. Normal range, we said, 35 to 45 millimeters of mercury, mean 40. Their PaO₂ is normal, between the range of 80 to 100 millimeters of mercury, breathing room air, but their bicarbonate is low. So they're losing bicarbonate for some reason. It's less than 22 millimoles per litre. And the base deficit is -6. It should not exceed -3. Normal range, we said, -3 to +3. Mean 0. So they're using up bicarbonate for some reason. So therefore this indicates that they have got a metabolic acidosis. We don't know why. Not from our blood gas here. You can't determine that. If you know the history and you've got a physical assessment and you've got other laboratory results, we might think, oh, this could be heart failure. This could be renal failure. This could be a diabetic ketoacidosis patient. Could be. Look at this one. What's your analysis? pH 7.50, PaCO₂ 28, PaO₂ 95, bicarb 25, base 0. So pH is abnormal. It tells you the story. Once upon a time there was a pH and it wasn't normal. So is there an acidemia or an alkalemia? Well, this is an alkalemia because the pH is now greater than 7.45. What's the problem? Well, the PaCO₂ is low. So they must be hyperventilating, breathing off carbon dioxide. Normal range, we said, 35 to 45 millimeters of mercury. So it's less than 35, they're hyperventilating. Oxygen's okay. Bicarbonate is normal. Base is normal. So this person is hyperventilating for some reason. They are in a respiratory alkalosis. Last one, I think. pH 7.49, PaCO₂ 40, PaO₂ 90, bicarb 32 millimoles per litre, base +6. Once upon a time there was a pH and it wasn't normal. So does it indicate acidemia or alkalemia? Well, this one indicates alkalemia because it's more than 7.45. The PaCO₂ is normal. The PaO₂ is normal. They're euoxic. They're breathing room air. But the bicarbonate is abnormally high. It's more than 28 millimoles per litre. And the base deficit, which is really the base excess, is +6. So pH saying alkalemia, bicarb base saying alkalemia, there's a metabolic problem. For some reason you're retaining bicarbonate. You have a metabolic alkalosis. Okay, thanks. That's the end of this session, part 2. I suggest you go to part 3, where we'll be reviewing compensatory mechanisms, which is an important concept to understand in arterial blood gas analysis.